Hi, this is Dr. Jim Anderson, and I'm here with Tori, and I'm very excited to talk about her history because it's a very, to me, a very amazing story. She comes in from her mom, because of her mom. We did some work on her mother too. And Tori is a rheumatoid patient. She's had rheumatoid arthritis at a very young age. She's 33. And she already has had 2 knee replacements and a hip replacement. So she comes into us with an arthritic foot that's so arthritic that there's not much for a surgeon to do with. And when a patient has very severe arthritis, a common thing in the foot at least is to fuse joints. Okay, you get rid of the joint and it can help, but her bones are so weak and unhealthy, they're actually going to do maybe like a titanium replacement, take bone out, do a 3D model, and substitute that into her body. Very, high risk?
Yes.
Not sure about success rate. So she came in here and we offer doing nerve resection, meaning that we can go in now and we take the nerve out and we bury it in muscle so the tip of it doesn't irritate. But we do that. There's like 4 of these nerves that we can do above the ankle that allow her to feel or not feel certain arthritic joints. So we did that, and it's been 4 weeks. So can you explain to me what's it been like? There's so much we could talk about. Yes, right? But,
so
yeah.
The joint that we were looking to treat, it was a very sharp pain. And it made me dread getting up in the morning, walking, any kind of activity, and I gave up a lot of, doing anything. And with the surgery, I don't feel any of that sharp pain anymore. My attitude has really changed. I'm like a completely different person, and it's really been wonderful.
Yeah, I mean, what was it like before? I mean, you came in here kind of on a whim, right? I mean, what drove you to come in here? How did you find out? Tell that story a little bit.
So my mom came in for some foot issues,
Right.
and I came in with her because you did a wonderful job with her surgery, and I was actually hoping that you would be able to direct me to some surgeons because my surgical options were not great, and you stopped me and asked what the issues were and offered this alternate solution.
Yeah, and so it's been well worth it. I mean, you're doing,
most definitely.
You can walk like you normally walk. She's favoring her foot quite a bit.
Yeah, it was a very awkward walk, and it was putting a lot of stress on my other joints and my other foot. Right. So, I didn't know what other problems that was going to cause.
Right. And so if we can, let's just pan down here for a second. So, and you can see her foot's fairly inflamed from the rheumatoid arthritis, but the joint she had complaints with was in this area, but there's a little scar up here. Again, she's about 4 weeks out, but it's called the saphenous nerve. And this nerve, it affects her ability to feel things here, but that's been removed and buried into muscle. And I do these for foot and ankle conditions, so a lot of people think they might need their ankle fused or their ankle replaced, but they don't need to have that done anymore. So it's another alternative instead of that. So, and right now we have another doctor that we brought on board that can do that for knees and other joints in the body. So it's just something for you listening out there, realize this is a new option that you can consider, and I feel like it's a far less risky thing to do. And yeah.
And I don't know why, but somehow with that and taking the pain down, my swelling has actually gone down in my foot.
There you go. Yeah.
So that's been a very nice
it's all good.
Additional thing.
Yeah. And maybe the bones can get a little stronger, maybe, with more activity.
Yeah.
If
Hope
it's
so.
done. Right. Anyway, you've been a pleasure to work with. And
thank you.
We really enjoy you sharing this because it's been an interesting journey.
Thanks.
So thanks. All right. Tori,